Hello, I'm Dr. Nicole Anderson, and I'm here to show you how to use silicone cups, aka myofascial decompression or cupping, to relieve myofascial stiffness around your knee. Oftentimes when people have knee pain, they think it's coming from the joint. But even if you've been told you have a degenerative knee or that you have patellofemoral syndrome or something wrong with your knee, oftentimes doing myofascial decompression or cupping is going to help. So pay attention. I'll give you some tricks and tips of some things that we do in the therapy clinic. And you can easily buy a set of these cups on Amazon. You can go to our webpage to find out which product we recommend. And then in physical therapy, we would do some other techniques that really require more expertise, but this is at least something that you can do to start moving the needle. Usually to solve knee pain, you need more than just cupping. Usually you often need the right types of exercises, and you could get started with some of those with our Total Body Reboot Level 1, Level 2 classes, but at least you can start to relieve some of your stiffness and pain with cupping, okay? So here we go. You're gonna need some coconut oil. I'm gonna grab some real quick. So just a little regular old coconut oil works well. Works better than most lotions. So let's say it's my right knee that I want to get some stiffness and soreness taken care of with. I'm gonna just rub on that coconut oil. And then I'm gonna take my silicone cup and I'm gonna just move it along the side of the knee like this. And if you find any areas where it feels like it's lumpy or bumpy, I call it speed bumps, then you know that's an area where the myofascial system has some stuck layers. And that means that the muscles in that area can't function as well because the fascia is trapping them. So we want to relieve that using cupping. So I found a few stiff, stuck areas. So now I'm gonna actually just tap that cup down right over one of those speed bumps, okay? So I just leave it right there. We don't wanna leave the cup for more than 2 minutes at a time. And what that's doing is it's actually decompressing the fascia. It's lifting the layers. So now the muscles in that area have space to do their thing. Now I'm gonna take, well, these two, they were over an area where I felt a speed bump. I felt a stiff area where it didn't glide as well. Now I'm gonna use this other cup on the other side and look for speed bumps. Ooh, got a couple. And this is a good thing to do even if you don't currently have a problem with your knee, but let's say you're a runner and you really need your knees to be working well for you, then cupping would be a good thing to do once a week, maybe before your recovery day, just to keep your tissue loose and happy, because stiffness is a pre-pain signal. So if you are experiencing some stiffness somewhere, then that means pain is on the way and you want to do something about it before it turns into a problem. So right now I've got the cups on a couple of areas where I had speed bumps on the inside, and I've got a cup on a speed bump on the outside, and I'm just gonna hang out here for a couple of minutes, let the cups do their thing, okay? And then after a couple of minutes, I'm gonna move them. Let's say it's been a couple minutes here, and it should glide easier. And it does, even though it hasn't been a couple minutes. Now it's really important that you don't do a heavy workout right after doing cupping. Give it 24 hours at least so that your body can adapt, and then make sure you get a really good warm up, because especially if something's been stiff and stuck for a long time, it is not going to be as strong because the muscles in that area have kind of forgotten what to do. So you have to make sure you get a really good warm up in the area and don't just dive right into something heavy. So I've done cupping all around my knee. You can even go over the top. And the nice thing about the silicone cups is they conform around areas that are not easy to conform around. So it works better than plastic cups, okay? And the other thing I like about silicone cups is it's pretty hard to injure yourself with them. Just don't leave it on and fall asleep, because then you could actually injure yourself. All right, so that's how you would do the knee. But anytime that you have a knee problem, you want to also do cupping to the calf and to the hamstring. So make sure you check out our videos on how to do that.